Good afternoon, everyone. My name is Zinah Sorefan, and I'm a Senior Analytical Manager in the Performance and Evaluation team at IRLS in NHS England and Improvement. And today I will be giving you an overview of the AAC Scorecard, which monitors the impact of the Accelerated Access Collaborative, and I will be introducing you to our plans to produce a novel innovation compartment on the model health system. Next slide, please. So to begin, the AAC Scorecard is an interactive Tableau dashboard hosted on the Future NHS Collaboration platform. It is designed to track and report the impact of the AAC and includes a range of measures that can be substantively and directly affected by the AAC programs. It also gives us a complementary view of the wider innovation landscape. We report our core metrics to the AAC board and stakeholders on a quarterly basis. Next slide, please. These core metrics are color-coded under the following 6 themes, namely support, which indicates support given to NICE-approved and early-stage innovations and innovators, access, which is the number of patients and sites accessing and benefiting from these innovations, benefits, which models expected clinical benefits versus alternative standard of care, savings, which is return on investment, economic growth, which is investment secured into supported companies, innovations and jobs created, and finally landscape, which includes measures not necessarily attributable to the AAC, but are nevertheless of interest as part of the wider innovation landscape. Next slide, please. So this slide here is a screenshot of the homepage of the scorecard. As you can see, in Q3 of 21-22, as a whole, the AAC programs provided access to health and care innovations to almost 500,000 patients across 315 sites in England. We have supported over 2,700 innovators and 2,900 innovations, delivering patient benefits with an estimated 6,900 fewer days spent in hospitals and 9,700 fewer hospital visits. Together, this has saved the NHS almost £0.3 million in Q3 of 21-22. So throughout this dashboard, there are really helpful tooltips and drop-downs which allows users to gain more insight into any particular metric, as well as delve into historic data at individual programme level. Next slide, please. Here we have clicked into the Access tab and filtered by MTFM programme. We can see that over 46,000 patients access MTFM innovations in Q3 of 21-22 across 200 sites. The chart shows the uptake of 4 current innovations on the MTFM mandate. These are GammaCore, HeartFlow, PLGF and SecuraCath, and the map shows the site stages of adoption. Stage 5, which is indicated by the dark green dots, means that adoption of innovations is well established and underway in these organisations. Next slide, please. So we are currently working with the Model Health System team to give providers better access to understanding innovation in their organisations. The Model Health System is an NHS improvement data-driven tool which helps system improve population health and patient outcomes. It provides benchmark data and insights and helps providers identify opportunities for improvement. It is well established and can be used by all NHS commissioners and providers in England. Next slide, please. So the idea of the innovation compartment is that we want to feature more granular MTFM uptake data alongside contextual metrics already hosted on the model health system. The aim is to give a holistic view of uptake and unpick any potential barriers to innovation across providers, have a one-stop shop for innovation, bringing together in one compartment publicly available metrics, and finally link to more high-level data hosted on the AAC scorecard, as I just demonstrated. And a final slide, please. So here are some further benefits to showcasing the MTFM data on the model health system. And the main one is being peer benchmarking, which gives users data on organisation size, case mix and other characteristics to help identify warranted and unwarranted variation. You can also view and download your organisation's data, compare to other trusts, national averages and peer groups, and switch to view any other providers across their ICSs or STPs at an aggregated system level. So this all gives organizations invaluable tools and tangible data to support innovation in their organization.